Alright, let's talk about something incredibly important, but also, let's be honest, a little awkward for some people: sexually transmitted infections and diseases. You've probably heard the terms STI and STD, and maybe you've wondered if they're the same thing. Well, they're related, but there's a small difference. An STI, or sexually transmitted infection, is when a germ, like a bacterium or a virus, gets into your body. Think of it as the first stage. Sometimes that infection doesn't cause any problems or symptoms, but if that infection starts to cause actual signs of illness, that's when we call it an STD, a sexually transmitted disease. The key takeaway, though, is that both start with an infection that is passed from one person to another, primarily through sexual contact. Now, it's super important to understand that having an STI is way more common than you might think. Millions and millions of new infections happen every single year all around the world. It's not something that only happens to certain types of people. It can happen to anyone who is sexually active. Getting an STI isn't a moral failing or a sign that you are a bad person. It's a health issue, plain and simple. It's like getting the flu or a cold, just transmitted in a different way. And because it's a health issue, we can talk about it, learn about it, and manage it with science and good information. So, how do these infections actually work? Well, it all comes down to some very tiny microscopic organisms. These are the culprits behind STIs, and they generally fall into three main categories: bacteria, viruses, and parasites. Let's start with bacteria. These are single-celled organisms that can live and reproduce inside your body. Think of them like tiny squatters that move in and, if left unchecked, can cause a lot of trouble. The good news about bacterial infections like chlamydia or gonorrhea is that we have a fantastic weapon against them: antibiotics. Next up, we have viruses. Viruses are even smaller and, frankly, a bit sneakier than bacteria. A virus isn't technically alive on its own. It needs to invade a host cell, one of your cells, to replicate. It's like a hijacker that takes over the cell's machinery to make more copies of itself. Because they integrate themselves into your own cells, viral infections are much trickier to get rid of. While we have antiviral medications that can manage the symptoms and stop the virus from replicating, for many viral STIs, there is currently no cure. Finally, let's talk about parasites. These are organisms that live on or in a host and get their food from or at the expense of that host. In the world of STIs, the most common parasite is a tiny protozoan called Trichomonas vaginalis, which causes an infection known as trichomoniasis. So we have these three different types of invaders, and knowing which type is causing an infection is critical because it determines the kind of treatment that will be effective. Let's zoom in on the bacterial STIs, which are some of the most common infections out there. First on our list is chlamydia. It's incredibly widespread, partly because it's often a silent infection. This means many people who have it don't show any symptoms at all, so they can pass it on without even knowing they're infected. When symptoms do appear, they might include unusual discharge from the penis or vagina, or a burning sensation during urination. Next is gonorrhea, which is often mentioned in the same breath as chlamydia because they share many similarities. Also, like chlamydia, gonorrhea is curable with antibiotics. However, and this is a big however, some strains of gonorrhea have become resistant to antibiotics, making them much harder to treat. This is a growing concern in the medical community, and a powerful reminder of why prevention and early treatment are so important. Then there's syphilis, an older and more complex bacterial infection. Syphilis is sometimes called the Great Pretender because its symptoms can look like many other diseases. It typically progresses in stages. The first stage is usually a single painless sore called a chancre at the site of infection. If still left untreated, syphilis can enter a latent stage for years before progressing to the final, most severe stage, which can damage the brain, nerves, and other organs. The good news? If caught early, syphilis is completely curable with penicillin, a powerful antibiotic. The common thread with all these bacterial infections is that they are treatable and curable, but only if you know you have them. Their ability to hide without causing symptoms is what makes them so sneaky and allows them to spread so easily. Regular testing is the only way to be sure. Moving on from bacteria, let's talk about a common parasitic infection called trichomoniasis, or trich for short. This STI is caused by a tiny single-celled parasite. What's fascinating and also challenging is that about 70% of people with trichomoniasis don't have any signs or symptoms. When they do appear, they can range from mild irritation to severe inflammation. For women, this might mean itching, burning, or soreness of the genitals and a thin, often frothy discharge with an unusual smell. The fantastic news is that trich is easily cured with a single dose of a prescription antibiotic medication. Now let's shift gears to the world of viruses and talk about herpes. Herpes is caused by the herpes simplex virus, or HSV. There are two main types, HSV-1, which most commonly causes oral herpes, cold sores around the mouth, and HSV-2, which most commonly causes genital herpes. The primary symptom of a herpes outbreak is one or more blisters on or around the genitals, rectum, or mouth. These blisters break and leave painful sores that may take weeks to heal. The first outbreak is often the most severe, and people may also experience flu-like symptoms like fever and body aches. Unlike the infections we've discussed so far, there is no cure for herpes. Once you have the virus, it stays in your body for life. It hides out in your nerve cells and can reactivate periodically, causing new outbreaks. But, and this is a very important but, it is a manageable condition. There are antiviral medications that can help prevent or shorten outbreaks. Taking these medications daily can also reduce the likelihood of passing the virus to a partner. Millions of people live perfectly healthy, happy lives with herpes. Alright, let's dive into two more very significant viral infections, HPV and hepatitis B. First up is the human papillomavirus, or HPV. This is the single most common sexually transmitted infection on the planet. In fact, it's so common that nearly all sexually active people will get some type of HPV at some point in their lives if they don't get vaccinated. There are over 100 different types of HPV. Many of them cause no problems at all, and your body's immune system clears the infection on its own, usually within a couple of years. However, some types of HPV are considered high risk because they can cause cancer. Specifically, certain HPV strains are the primary cause of cervical cancer in women. They can also cause cancers of the vulva, vagina, penis, anus, and the back of the throat. Other low-risk types of HPV can cause genital warts, which are growths or bumps that appear on the genital area. While genital warts are not life-threatening, they can be uncomfortable and distressing. Now, for the really good news about HPV, we have a powerful tool to fight it. There is a safe and effective HPV vaccine. This vaccine can protect against the types of HPV that cause most cervical cancers and genital warts. It's recommended for preteens, both boys and girls, so they are protected long before they become sexually active. The vaccine is a monumental achievement in public health because it is, essentially, an anti-cancer vaccine. It's one of the most effective ways we have to prevent certain types of cancer from ever developing. Another important viral STI to know about is hepatitis B. This is a virus that attacks the liver. A hepatitis B infection can be either acute, meaning a short-term illness, or chronic, meaning a long-term, lifelong infection. A chronic infection can lead to serious liver damage, including cirrhosis, which is scarring of the liver, liver failure, and liver cancer. Like many other STIs, it often doesn't cause symptoms, so people can be infected for years without knowing it. And like HPV, there is no cure for chronic hepatitis B, but there are treatments to manage it. But here again we have a superhero on our side, a vaccine. The hepatitis B vaccine is highly effective and is a standard part of childhood immunizations in many countries. Now we need to talk about one of the most well-known and historically feared STIs, HIV. HIV stands for Human Immunodeficiency Virus. As its name suggests, this virus attacks the body's immune system, specifically a type of white blood cell called the CD4 cell or T cell. These cells are like the generals of your immune system's army. They lead the charge against infections. Over time, HIV destroys these cells, weakening the body's ability to fight off other diseases and infections. When a person first gets HIV, they might experience short, flu-like symptoms for a few weeks, but then they may feel perfectly fine for years. If HIV is left untreated, it can eventually progress to AIDS, which stands for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV infection. A person is diagnosed with AIDS when their immune system is severely damaged, meaning their CD4 cell count is very low, or when they develop certain opportunistic infections. These are illnesses that a healthy immune system would normally be able to fight off, but they can become life-threatening for someone with AIDS. For a long time, an HIV diagnosis was considered a death sentence. But today the story is vastly different. While there is still no cure for HIV, there has been incredible progress in treatment. We now have highly effective medications called antiretroviral therapy, or RT. ART works by stopping the virus from making copies of itself. This allows the immune system to recover, and a person's CD4 count to go up. People with HIV who start ART, take it every day as prescribed, and maintain an undetectable viral load can live long, healthy lives and will not transmit the virus to their sexual partners. This last point is revolutionary. It's a concept known as undetectable equal sign, untransmittable, or U equal sign U. When the amount of HIV in a person's blood is so low that a standard lab test can't detect it, they have an undetectable viral load. And scientific evidence has overwhelmingly shown that if their viral load is undetectable, they cannot pass HIV to a partner through sex. This has transformed what it means to live with HIV, reducing stigma and offering incredible hope. It underscores the life-saving importance of getting tested for HIV and starting treatment if needed. We've mentioned this over and over, but it deserves its own section because it is the single most important action you can take for your sexual health: getting tested. Why? Because as we've seen, the majority of STIs are like secret agents. They can infiltrate your body and cause no symptoms, sometimes for years. You can look and feel perfectly healthy and still have an infection that you can pass on to someone else. You simply cannot know your status based on how you feel. Think of it like this. You wouldn't know if you had high blood pressure just by guessing. You need a doctor to use a blood pressure cuff to get an accurate reading. STI testing works the same way. Getting tested isn't a sign that you've done something wrong. It's a sign that you are being responsible, proactive, and mature about your health. It's a routine part of healthcare for anyone who is sexually active, just like getting your teeth cleaned or having an annual physical. So what does getting tested actually involve? It's usually very simple and painless. Depending on what you're being tested for, it might involve giving a urine sample, having a simple blood test, or using a cotton swab to take a sample. A healthcare provider can tell you which tests are right for you based on your sexual history. The process is confidential, and clinics are safe spaces where you can ask questions without judgment. The temporary discomfort of a swab or a needle poke is a tiny price to pay for peace of mind. So now that we know what STIs are and why testing is so important, let's talk about the best-case scenario: preventing an infection from happening in the first place. The most well-known and effective tool is the condom. When used correctly and consistently every single time you have sex, both male and female condoms are excellent at preventing transmission. This brings us to our next powerful tool: vaccinations. Getting vaccinated is one of the best things you can do to protect yourself from these specific viruses for your entire life. Another key component of prevention is communication. Talking with your partner or partners about sexual health before you become sexually active is crucial. This conversation can include talking about your sexual histories, discussing when you were both last tested, and agreeing on what prevention methods you will use together. But whatever your choices are, the core principles remain the same. Use barriers like condoms, get vaccinated, get tested regularly, and talk openly with your partners. Combining these strategies gives you the best possible defense. So, we've covered a lot of ground. We've journeyed from the microscopic world of bacteria and viruses to the very practical steps of testing and prevention. The single most important message to take away from all of this is that your sexual health is a vital part of your overall health. It deserves your attention, your care, and your respect. It's not a scary, taboo topic to be hidden in the shadows. It's a normal aspect of human life that we can and should talk about openly and honestly. Knowledge is the antidote to fear, and education is the enemy of stigma. Remember that having an STI is a medical condition, not a moral judgment. Millions of people have them, manage them, and live full, happy, and healthy lives. The shame and stigma that have surrounded these infections for centuries have done far more damage than the germs themselves. By preventing people from seeking the information, testing, and treatment they need, we can change that. Every time we have an honest conversation, ask a question, or support a friend who needs to get tested, we are chipping away at that stigma and building a healthier, more compassionate world. You are the author of your own health story. You have the power to make informed decisions that protect you and the people you care about. Be curious, ask questions, talk to a doctor, a nurse, a school counselor, or a trusted adult. There is a vast community of healthcare professionals and advocates who are here to help you without judgment. Use the incredible resources available online from reputable organizations like the Centers for Disease Control and Prevention or the World Health Organization. You are never alone in this. So take a deep breath. Let go of any fear or shame you might have felt about this topic. Instead, feel empowered. You are now equipped with the fundamental knowledge to navigate your sexual health with confidence. Take care of yourself, take care of others, and continue to learn. Your health is your most precious resource. Protect it, cherish it, and never ever be ashamed to advocate for it. Thank you for watching, or in this case, reading.